let's talk about tuberculosis, also known as TB, ripped from the headlines. You've probably heard that there is a significant outbreak in the Kansas City area, which is one of the largest outbreaks in the United States since the 1950s. Worldwide, tuberculosis is actually the #1 infectious killer, and about 1.5 million people die around the world each year. They estimate that about 1 to 2 billion people are infected and may not even know it. That's because tuberculosis can be infection or can be disease. The difference in the tuberculosis infection, or what some people call latent TB, is just where you are carrying it around and it's living in your body. TB disease or active tuberculosis is when it actually starts to have effect and you get sick from it. Risk factors for catching tuberculosis are anyone who's in a correctional facility or people who are in a homeless type situation. Those are the two most common. We see it sometimes in healthcare workers who may be exposed, or people who travel to areas where the tuberculosis rates are high. There's a huge long list of those countries. You can look them up online. I don't need to list them all for you. Also, close contact with an infected individual. Generally, we say that you need to be around that person for greater than 4 hours, but of course there's no magic number of minutes that you can or cannot be around someone that's considered safe. People who are at higher risk for going from infection or latent TB to active TB or tuberculosis disease are people who have underlying health conditions that we talk about in all sorts of things who are higher risk. So we're talking about people who have autoimmune disease or who take immune suppressive drugs, people who have HIV. There's actually a significant number of people who have both HIV and tuberculosis together, people who have underlying lung disease, diabetes, and on and on. You know the rest. It is transferred by respiratory droplets, meaning someone coughs or sneezes or whatever, it's in the air and then someone else inhales it. So one of the main problems with it is that it can live for a long time. It can stay aerosolized for a long time. This is why in the Old West, if you know the movie Tombstone, it's Doc Holliday, and there are signs in the old saloons that say no spitting. It's because people had tuberculosis and they didn't want you to spread it in their saloon. People who have tuberculosis disease are typically pretty sick. Most of the time they've been coughing for at least 2 to 3 weeks. Fever, night sweats, lymph node swelling or what we call lymphadenopathy, unexplained weight loss, and they feel really, really bad. So if you're just coughing for a couple of weeks after a cold, don't freak out, don't panic. It's probably not tuberculosis if you're in the United States. But if you have exposure risks, then it's certainly worth getting tested. Testing usually consists of either a blood test or a skin test where they give you a little injection on your forearm and then they read that test 48 to 72 hours later, and they can tell by if you have a reaction, how large it is, or how bumpy or indurated it gets as to whether you have tuberculosis or not. From there, then you go to confirmatory testing with chest x-rays or blood tests, or they might even want cultures of the stuff you're coughing up, which we call sputum. It's not the same as post-nasal drip or just drainage. This is actually stuff you're coughing up from your lungs. That's where these acid-fast bacilli are. They can culture that, and they can also do a stain where they can see it on a slide. And so usually they'll get a set of 3 of those because a clear one doesn't necessarily mean you don't have it, so they like to get 3 of those. With tuberculosis, usually it's the lungs and respiratory system that are affected most and can go as severe as what we call pulmonary cavitation, which is where damage to the lung tissues and it basically forms a cavity or a hole in there because you're coughing up damaged lung tissue. That can lead in severe cases to collapsed lungs and respiratory arrest. It can also travel to other parts of your body and affect the spleen, the lymph nodes, the nervous system. It can cause meningitis, can go pretty much anywhere in your body and can be devastating when that happens. So, in order to appropriately treat people when they have infection, sometimes we treat them preventatively so they don't proceed to disease. We have to weigh the risks versus the benefits because these medicines can have a lot of side effects. So, it's certainly something to go over. There are a lot of different algorithms on the treatment, but the mainstays of treatment are isoniazid and rifampin and some combinations thereof. And so you just have to figure out which one's going to be best for you. And it's usually at least 3 to 4 months of antibiotics, if not more like a year. So it's a big deal, but most of the time, if you are tested positive for tuberculosis, you're going to be referred on to the health department where they'll have a TB control center, and they will get you in their treatment plan and hopefully get this eradicated. So, Doc Holliday, if you're a dirty lunger, you probably should go get yourself checked. Make sure that you're not spreading this to other people. I sure wish you the best of luck.